Hi, my name is Mariceli Miller, and today I'll be talking about the quality of care. Is the way physicians get paid affecting the quality of health care? How much time do patients really spend with their doctors? These are questions that I'm going to try to answer. Let me start by sharing my experience with doctor visits and medical bills. I was diagnosed with breast cancer almost 2 years ago. I was visiting specialist after specialist. Thankfully, I had good insurance, so I didn't have to worry much about how much my visits cost. I will always visit the doctor and spend 5 to 8 minutes actually talking to the doctor. They never did anything complicated for my doctor visits to be $300 or more. When I received my monthly insurance statement of how much they cover for my visits, I was glad I didn't have to come out of pocket to pay. During my visits, I always felt I was getting rushed and didn't get answers to my concerns as thoroughly as I would want to. For my whole treatment, I trusted that my oncologist knew what he was doing and the decisions he was making were the right decisions. After my research, I found that different kinds of specialists get paid different. Some get paid less than others, but still making six-figure digits, which I think is good either way compared to other jobs. I am a big believer that physicians deserve the best pay that can be given to them. I also believe patients deserve the best health care that a physician can offer, no matter their income level or payment method. In my research, I found that there are 6 models through which a doctor gets paid, one of them being fee-for-service. Doctors that get paid by this method are more likely to provide services that are not needed by the patient, which leads to unnecessary procedures and high-cost doctor visits. In the United States, doctors are being encouraged to move to a new payment method called capitation, but physicians are not moving fast enough to this method because fee-for-service is more convenient for them. 73% of physicians are still getting paid through fee-for-service. The fear that comes with fee-for-service of doctors overtreating also comes with capitation of doctors undertreating. As patients, we shouldn't be worried that a doctor is going to underutilize services or overutilize services because of the method that he is getting paid. Patients need to trust their doctors so they can continue seeking care and not feel that going to see a doctor is useless. When I first visited my oncologist for the diagnosis that I already shared, I shared with my doctor that I will be moving to Santa Clarita and if he could help me get an oncologist closer to me, since driving to Burbank from Santa Clarita for chemotherapy might be too much. My oncologist responded that I couldn't because a new doctor wouldn't be able to continue my treatment from where I was at the moment. I didn't know anything about the rules of switching doctors for my issues, so I was okay with it. When I started radiation, my radiation oncologist informed me that it wasn't hard to switch oncologists like I wanted. My oncologist just wanted to keep me for whatever money he will be getting paid for having me as a patient. He wasn't worried about the distance I was going to travel to see him. Only in my personal experience I could give example after example of how money is affecting the quality of care that is given to patients day after day. How can we fix this issue? A potential solution to this problem can be to pay doctors a fixed salary rather than fee-for-service. The salary will have to be a well-deserving amount that can satisfy the physician's specialty in their field of work. In the documentary Escape Fire, they gave an example of a medical group that gets paid by salary. They are the Cleveland Clinic. Physicians get paid the same rate whether they perform procedures or simply advise patients of their conditions. This medical group wants to focus on quality rather than quantity. Quality should be what every doctor provides for patients. Other medical groups that are succeeding in quality instead of quantity is the Mayo Clinic. The Mayo Clinic pays their doctors by salary and is one of the top hospitals in the United States, with low-cost visits and healthier patients. If doctors getting paid salary is working for the few medical groups that have taken this challenge, it can work for every hospital and clinic in the United States. The Cleveland Clinic and Mayo Clinic are perfect examples of doctors and salary works. People in the medical field need to stop seeing the practice of medicine as a business. Medicine is to help people get better and live healthier lives, not a business.